Diseases and their key associations. What is the most common mode of mitochondrial inheritance? Disease occurs in both males and females but is inherited through females only. What is the most common cause of intellectual disability? Down syndrome, Fragile X syndrome. What is the most common vitamin deficiency in the USA? Folate deficiency, especially in pregnant women, prevents neural tube defects. What is the most common lysosomal storage disease? Gaucher disease. What is the most common cause of bacterial meningitis in patients older than 6 months? Streptococcus pneumoniae. What is the most common cause of bacterial meningitis in newborns and children? Group B Streptococcus, E. coli, Listeria monocytogenes. What is the most common HLA association with diabetes mellitus type 1? HLA-DR3 and HLA-DR4. What bacterium is most associated with gastritis, peptic ulcer disease, and gastric malignancies? Helicobacter pylori. What is the most common opportunistic respiratory infection in AIDS patients? Pneumocystis jirovecii pneumonia. What is the most common helminth infection in the U.S.? Enterobius vermicularis, pinworm. What virus is most commonly associated with viral encephalitis affecting the temporal lobe? HSV-1. What infection is most commonly associated with blood transfusion? Hepatitis C. What bacteria most commonly cause food poisoning via exotoxins? Staphylococcus aureus, Bacillus cereus. What is the most common cause of osteomyelitis? Staphylococcus aureus. What is the most common cause of osteomyelitis in patients with sickle cell disease? Salmonella. What is the most common cause of osteomyelitis in 4 drug users? Staphylococcus aureus, Pseudomonas, Candida. What is the most common cause of UTIs? Escherichia coli, Staphylococcus saprophyticus, young women. What is the most common sexually transmitted disease? Chlamydia trachomatis, usually co-infected with Neisseria gonorrhoeae. What is the most common cause of nosocomial pneumonia? Staphylococcus aureus, Pseudomonas, Klebsiella, Acinetobacter. What is the most common cause of pelvic inflammatory disease, PID? Chlamydia trachomatis, Neisseria gonorrhoeae. What is the most common site of metastasis to bone? Prostate, breast, kidney, thyroid, lung. What is the most common site of metastasis to the brain? Lung, breast, melanoma, colon, kidney. What is the most common site of metastasis to the liver? Colon, stomach, pancreas. What is the S3 heart sound associated with? Increased ventricular filling pressure, e.g., mitral regurgitation, heart failure, common in dilated ventricles. What is the S4 heart sound associated with? Stiff/hypertrophic ventricle, e.g., aortic stenosis, restrictive cardiomyopathy. What is the most common cause of constrictive pericarditis in the developing world and the developed world? Developing world, TB, developed world, idiopathic, viral illness. What is the most common cause of a holosystolic murmur? VSD, tricuspid regurgitation, mitral regurgitation. What is the most common cause of an ejection click? Aortic stenosis. What is the most common cause of mitral valve stenosis? Rheumatic heart disease. What is the opening snap associated with? Mitral stenosis. What is the most common congenital heart murmur? Mitral valve prolapse. What is the most common chronic arrhythmia? Atrial fibrillation, associated with a high risk of emboli. What are the most common causes of early cyanosis? Tetralogy of Fallot, transposition of great vessels, truncus arteriosus, total anomalous pulmonary venous return, tricuspid atresia. What is the cause of a late cyanotic shunt, uncorrected left to right becomes right to left? Eisenmenger syndrome, caused by ASD, VSD, PDA, results in pulmonary hypertension/polycythemia. What is the most common congenital cardiac anomaly? VSD. What is the most common cause of secondary hypertension? Renal artery stenosis, chronic kidney disease, e.g., polycystic kidney disease, diabetic nephropathy, hyperaldosteronism. What is the most common cause of thoracic aortic aneurysm? Marfan syndrome, idiopathic cystic medial degeneration. What is the most common cause of abdominal aortic aneurysm? Atherosclerosis, with smoking as a major risk factor. What is the most common cause of ascending or arch aortic aneurysm? Tertiary syphilis, syphilitic aortitis, vasa vasorum destruction. What are the most common sites of atherosclerosis? Abdominal aortic coronary artery, popliteal artery, carotid artery. What is the most common cause of aortic dissection? Hypertension. What is the most common cause of right heart failure due to a pulmonary cause? Cor pulmonale. What is the most commonly affected heart valve in bacterial endocarditis? Mitral aortic, rheumatic fever, tricuspid, for drug abuse. What is the presentation of endocarditis associated with different bacteria? Staphylococcus aureus, acute, for drug abuse, tricuspid valve, viridans streptococci, subacute, after dental procedure, streptococcus bovis, colon cancer, culture negative, e.g., Coxiella, Bartonella, Hayseck. What is the most common risk associated with temporal arteritis? Ipsilateral blindness due to occlusion of the ophthalmic artery, associated with polymyalgia rheumatica. What is the most common presentation of recurrent inflammation/thrombosis of small/medium vessels in extremities? Berger disease, strongly associated with tobacco. What is the most common primary cardiac tumor in children? Rhabdomyoma, often seen in tuberous sclerosis. What is the most common cardiac tumor in adults? Metastasis, myxoma, 90% in the left atrium, ball valve. What is the most common cause of congenital adrenal hyperplasia with hypotension? 21-hydroxylase deficiency. What is the most common cause of hypopituitarism? Pituitary adenoma, usually a benign tumor. What is the most common cause of congenital hypothyroidism, cretinism? Thyroid dysgenesis/dyshormonogenesis, iodine deficiency. What is the most common type of thyroid cancer? Papillary carcinoma, especially after childhood irradiation. What is the most common cause of hyperparathyroidism? Accidental excision during thyroidectomy. What is the most common cause of primary hyperparathyroidism? Adenomas, hyperplasia, carcinoma. What is the most common cause of secondary hyperparathyroidism? Hypocalcemia of chronic kidney disease. What are the most common causes of Cushing's syndrome? Iatrogenic, from corticosteroid therapy, adrenocortical adenoma, secretes excess cortisol, ACTH secreting pituitary adenoma, Cushing disease, paraneoplastic, due to ACTH secretion by tumors. What is the most common cause of primary hyperaldosteronism? Adrenal hyperplasia or adenoma. What is the most common adrenal medulla tumor in children? Neuroblastoma malignant. What is the most common adrenal medulla tumor in adults? Pheochromocytoma, usually benign. What is the most common cause of refractory peptic ulcers with high gastrin levels? Zollinger-Ellison syndrome, gastrinoma of duodenum or pancreas, associated with men 1. What is the most common type of esophageal cancer worldwide and in the U.S.? Squamous cell carcinoma, worldwide, adenocarcinoma, U.S. What is the most common acute gastric ulcer associated with CNS injury? Cushing ulcer, intracranial pressure stimulates vagal gastric H+ secretion. What is the most common acute gastric ulcer associated with severe burns? Curling ulcer, due to greatly reduced plasma volume leading to sloughing of gastric mucosa. What is the most common type of bilateral ovarian metastases from gastric carcinoma? Krukenberg tumor, mucin-secreting signet ring cells. What is the most common cause of chronic atrophic gastritis? Autoimmune gastritis, predisposes to gastric carcinoma and pernicious anemia. What is the most common pattern of alternating areas of transmural inflammation in the colon? Skip lesions, Crohn's disease. What is the most common site of diverticula in the GI tract? Sigmoid colon. What is the most common diverticulum in the pharynx? Zenker diverticulum, diagnosed by barium swallow. What are the most common causes of hepatocellular carcinoma? HBV, with or without cirrhosis, other causes of cirrhosis, e.g., alcoholic liver disease, hemochromatosis, aflatoxins. What is the most common congenital conjugated hyperbilirubinemia presenting with black liver? Dubin-Johnson syndrome, inability of hepatocytes to secrete conjugated bilirubin into bile. What is the most common hereditary harmless jaundice? Gilbert's syndrome, benign congenital unconjugated hyperbilirubinemia. What is the most common genetic mutation in Wilson disease? Hereditary ATP7B mutation, copper buildup in liver, brain, cornea, kidneys. What is the most common cause of hemochromatosis? Multiple blood transfusions or hereditary HFE mutation can result in heart failure, bronze diabetes, and increased risk of hepatocellular carcinoma. What are the most common causes of acute pancreatitis? Gallstones, alcohol. What are the most common causes of chronic pancreatitis? Alcohol, in adults, cystic fibrosis, in children. What is the most common cause of microcytic anemia? Iron deficiency. What is the most common cause of autosplenectomy? Sickle cell disease, hemoglobin S. What is the most common bleeding disorder with GPIB deficiency? Bernard-Soulier syndrome, defect in platelet adhesion to von Willebrand factor. What is the most common bleeding disorder with GPIIB/3A deficiency? Glanzmann thrombasthenia, defect in platelet-to-platelet aggregation. What is the most common hereditary bleeding disorder? Von Willebrand disease. What is the most common hereditary thrombophilia? Factor V Leiden. What are the most common triggers of DIC? Severe sepsis, obstetric complications, cancer, burns, trauma, major surgery, acute pancreatitis, acute promyelocytic leukemia. What is the most common malignancy associated with non-infectious fever? Hodgkin lymphoma. What is the most common type of Hodgkin lymphoma? Nodular sclerosis. What is the genetic translocation T1418 associated with? Follicular lymphoma, BCL2 activation, anti-apoptotic oncogene. What is the genetic translocation T814 associated with? Burkitt lymphoma, c-MYC fusion, transcription factor oncogene. What is the most common type of non-Hodgkin lymphoma? Diffuse large B-cell lymphoma. What is the most common primary bone tumor in adults? Multiple myeloma. What is the age distribution of patients with all CLL, AML, and CML? All, child, CLL, adult greater than 60, AML, adult 65, CML, adult 45 to 85. What are the most common malignancies in children? Leukemia, brain tumors. What is the most common cause of death in CML? Blast crisis. What is the genetic translocation T922 associated with? Philadelphia chromosome, CML, BCR-ABL oncogene, tyrosine kinase activation, more rarely associated with all. What is the most common cause of vertebral compression fracture? Osteoporosis. What diseases are most commonly associated with HLA-B27? Psoriatic arthritis, ankylosing spondylitis, IBD-associated arthritis, reactive arthritis. What is the most common cause of death in SLE? Lupus nephropathy. What is the most common tumor of infancy? Strawberry hemangioma, grows rapidly and regresses spontaneously by childhood. What skin condition is a precursor to squamous cell carcinoma? Actinic, solar, keratosis. What is the Herald patch associated with? Pityriasis rosea. What is cerebellar tonsillar herniation associated with? Chiari eye malformation. What is atrophy of the mammillary bodies associated with? Wernicke encephalopathy, thiamine deficiency causing ataxia, ophthalmoplegia, and confusion. What is the most common cause of epidural hematoma? Rupture of middle meningeal artery, trauma, lentiform shaped. What is the most common cause of subdural hematoma? Rupture of bridging veins, crescent shaped. What are the most common causes of dementia? Alzheimer's disease, multiple infarcts, vascular dementia. What is the most common demyelinating disease in young women? Multiple sclerosis. What is the most common brain tumor in adults? Supratentorial, metastasis, astrocytoma, including glioblastoma multiforme, meningioma, schwannoma. What is the most common pituitary tumor? Prolactinoma, somatotropic adenoma. What is the most common brain tumor in children? Infratentorial, medulloblastoma, cerebellum, supratentorial, craniopharyngioma. What is the most common mixed, UMN and LMN, motor neuron disease? Amyotrophic lateral sclerosis, ALS. What conditions are associated with the degeneration of dorsal column fibers? Tabes dorsalis, tertiary syphilis, subacute combined degeneration, dorsal columns, lateral corticospinal, spinocerebellar tracts affected. What is the most common glomerulonephritis in adults? Berger disease, IgA nephropathy. What is the most common nephrotic syndrome in adults? Membranous nephropathy. What is the most common nephrotic syndrome in children? Minimal change disease. What are the different types of kidney stones and their appearances on imaging? Calcium equals radiopaque, struvite, ammonium equals radiopaque, formed by urease positive organisms, uric acid equals radiolucent, cysteine equals faintly radiopaque. What is the most common renal tumor? Renal cell carcinoma, associated with von Hippel-Lindau cigarette smoking, paraneoplastic syndromes, EPO, renin, PTHRP, ACTH. What is the most common cause of primary amenorrhea? Turner syndrome, 45XO or 45XO/46XX mosaic.